Welcome to the Global Public Health Revolution, the podcast by the AIDS Healthcare Foundation, where global public health meets bold advocacy and game-changing marketing to spark real change. Globally, men's health remains a critical concern as men experience poor health outcomes across different health issues. They also experience higher rates of mortality and morbidity compared to women. Conversations about men's health, HIV, prostate cancer, or simply going for a checkup are often avoided to seem strong and tough. This results in many seeking medical care only in emergencies or when it's too late. Today, we're exploring a topic that often doesn't receive the attention it deserves: men's health. Let's get started. For this episode, I'm joined by Norman Nixon and Trevor Imogel to discuss how we can move from silence to action, from avoidance to prevention, and why these conversations matter, not just for men themselves, but for families and communities everywhere. Hi, Norman and Trevor. It's such an honor to have you on the Global Public Health Revolution podcast today.
Well, Kimmy, thank you for inviting me. It's my pleasure, and it's always fun to get other perspectives on health from a different part of the world. Uganda is a long ways from here. His take on it is going to be based on his experience and historical facts. And my take on health is going to be based on my experience here in the United States and what we went through and the stigmas and all the things. And I'm sure we're going to get into all of that. But thank you for having me.
Excellent. Exactly why we have the both of you. Trevor, good to have you.
And yes, I am very deeply delighted and super excited to looking forward to how we unpack issues on men's health. My name is Trevor Imogel. I am an HIV activist. I am also the country youth coordinator, AHF Uganda Cares, where I coordinate HIV care and treatment, prevention, and advocacy programs for young people. But I'm also very interested in policy discussions, especially how we can harness policy functionality to improve health outcomes.
Thank you so much, Trevor. And thank you because you've already set us off with the first question, which is basically to tell us about yourself. So I'm glad that you've done that. And I'm going to turn the spotlight to Norman because most people don't know, or a lot of people do know, that Trevor is right when we say it's an intergenerational conversation because there's two generations represented here. But it's also two men from different fields who are passionate about some of the same things. So now, do you want to tell us about yourself?
I'll do a short version because there's a whole lot going on over here. Was born in Macon, Georgia. Grew up in Georgia. I grew up during a time when there was segregation, and our biggest thing was how do we get out of the projects and how do we make a better life to ourselves. So most of us went to college on either sports scholarships or guys went into the military to get scholarships to go through college. I went on a basketball scholarship. From there, I was drafted by the Lakers, played professional basketball for a long time, had an opportunity to win a few championships along the way, played with guys like Magic, Kareem. We had arguably one of the best teams in NBA history. Married Miss Debbie Allen, who's an iconic dancer, entertainer, who also dancers are athletes as well. So marrying Debbie, honed in my eating habits even better, different philosophies on stretching, exercising, and taking care of yourself. Since that time, I still do television. I work with AIDS healthcare and help create experiences to make people more comfortable with testing in an environment where there are other people. I'm sure we'll get into that. And now we have a huge dance academy where we have kids from all over the country come, all age groups. And part of that was born out of my wife's experience and not being able to take classes because she was from the segregated South. So when we reached a position in our lives, she wanted to create a place where kids could come and dance regardless of economic background, color, skill. If they want to dance, we make it possible for them to get great training, not just dance. But we have one of the best dance academies in the country here. So that's briefly a little bit about me. But as we go along, you can pepper me with some questions.
I'll be more than happy to. So Listeners, we have MBA royalty in the house, and we also have a formidable youth advocate. So, very nice mix. And I'm looking forward to this conversation. I'm excited about it because you both have already started sharing in terms of your journey. So, I just want to ask let's start with Trevor. When you hear men's health, what comes to your mind? And do men your age, so younger men now, do they take that seriously?
Okay, so like you mentioned in the beginning, men's health is quite a conversation that is not very reflected in global but also local discourse. There's not been a lot of conversation on how we can harness men's health, and even when you look at country level, there is still quite a bit of a gap. There's quite a bit of a gap there. And when it comes to young people, maybe to start with young men, I would say that first thing is that when you talk about health and testing and checking your body, young men will tell you that no, health is such things are for when I'm getting older and not when I'm currently at this state, because we have energy, we are, energetic, strong. So they think that health concerns, testing, and all that is for when you're getting older. So maybe we'll pick the conversation from there, but that is the experience we have with young men. Though at country level, I also just wanted to say that there is a big way we frame health as a women's issue and not so much of a men's issue, which is actually a very big challenge. When you look at even the decision makers, their perspective towards health is I am a gatekeeper, but not a direct beneficiary of health. So we find that gap that men are not really seeking health, but they look at it as for women or other stakeholders and not men particularly. So that is a serious gap that we have.
Trevor, you raise a very important point. I'm going to come to Norm in a bit, but you've highlighted something that I'm hoping that this conversation can help us shift that narrative. And it's the fact that you say a lot of times when we think of health, even for the stakeholders, the feeling is or the thinking is it's women. We're talking about women and girls. We do get that, yes, there are certain issues where women and girls are disproportionately affected. But I think that's something that we need to think about and see how do we shift it so that men don't only see it as my job is just to make sure that women get, the health care that they deserve. But my health is also important as a man, and I need to pay attention to it as much as I'm doing to, women's health and, young girls' health, for example. Norman, let's talk about what may be the cause because many men tend to put off checkups until it's too late. We've seen that even with HIV. A lot of men present very late. And even for things like sexual health or mental health, men oftentimes present late. And there are studies to show that. We have research that speak to that. What do you think is the reason for this?
Macho men. We're macho men. We don't think anything bother us. With HIV in particular, I was around when it first came on the scene. Again, I was around dancers, in the 70s and 80s when AIDS was really coming onto the scene, and there was a stigma around it. So guys didn't want
Yeah,
to get tested because they didn't want to know. Guys don't like to take physicals because a lot of times they don't want to know if they have a problem. Like, yeah, I'll just let it happen. But again, I'm in the preventive. I want to know before it comes. So I'm taking my test. I want to know what's happening
great.
before it gets there
Yeah,
so I can try to prevent it getting worse. But it's the macho thing. Men, we're men. Nothing hurts us. It's cold. I don't want to take that shot. I'm not going to a doctor. I'm okay. Give me some, give me a couple of aspirin, then I'm okay. So I think
yeah.
it's the mentality, it's the macho mentality. I think sometimes you have to break that down in men. It's like, hey man, you better go take care of yourself until they have prostate cancer, until they find
Yeah.
out they have diabetes, So and how do you commit? Get the weight off, watch your diet, exercise. But so it's the macho thing more than anything else.
Trevor, is that the same?
Yes.
Do you feel the same way?
So I wanted to build on my point. There is something that I should have mentioned previous. So there is something again unique about this generation that I thought I would add to the discussion. That for many of the young people around my age, we've grown up in broken homes or families where you do not have both parents. And I would say that HIV/AIDS also contributed to this because, again, it took parents. There was a lot of young people getting orphaned at a very young age. So we didn't have the benefit of the full parenting. And so you find that such people grow up with low self-esteem. They grow up with a failure to form healthy relationships. Actually, right now, the young people around my age are really struggling. I'm 27 years old right now, and that is really the age people are getting married. But you would see they are not keeping their relationships right. There's a lot of breakups, low self-esteem, and such a person cannot actually take their health seriously. And so that is something that this generation is grappling with. So we're having something called improvised parenting right now. You know, you find your manager that embodies fatherly values, so you lean towards them. A mentor or something. So it's a little bit of trying to fill the void that was left maybe by an absence of a father or something. But getting to this point, I would like to say that, yes, when you look at HIV, I mean, when it comes to testing, for young men also, what I've observed largely is, for example, when you tell someone, go and take an HIV test, the first question they will ask you is, what if I turn positive? You know? So they are scared of knowing the bad. They are scared of knowing the results. Actually, because that is where they're not scared of the injection. They're not scared of the needle. They're scared of the result. Okay? Which is a challenge. And also another thing is they fear the vulnerability. You get home and then, because sometimes they associate sickness with vulnerability and weakness. So when you get home and then you're positive, people will see you as now frail or something. So there is a strong fear of, first of all, knowing the bad, which is supposed to be the opposite, because you get to know early and then you treat it, but they will only go for the services when it's in the late stages, like when the cancer has developed, when the AIDS now has started setting in after the HIV has overly grown. And so that is a strong similarity with the young men as well.
I want us to stay a bit on the conversation of strength, what strength means to men, especially when it comes to health. Because you've talked about it, Norman talked about it as well. It's the macho man, when they tell you, men don't get sick. And some say, oh, well, I have to provide for my family, so I don't have time to go to a doctor and sit and wait. But we also know that that's also deeply rooted in culture, it's rooted in gender norms. It's the belief that as a man, you have to always be strong and tough. But we also know that it is possible for strength to be redefined, because seeking help or preventive care or going to the doctor, that in itself, isn't that a form of strength?
I would reframe it in another way, not necessarily strength, but wisdom. As we grow older and you learn different things, you want to be around for your family. And I think that's a part of wisdom, to say you want to take care of yourself so you can be there to protect your family, to do whatever you have to do for your family. So I don't know if it's necessary strength or it's just wisdom. So for me, I rather frame it as wisdom.
Okay. I hear you when you say it's wisdom, but I'm also trying to make the connectivity with how oftentimes for men who don't seek care, they're often tied to weakness. It's saying that if I seek care, then I'm weak. So couldn't we redefine it that if you make a proactive approach, it's you also standing up strong for health, for wellness, right?
I'll go to how Trevor answered that question.
Okay.
It could be strength because men don't want to know. That's that macho part. It would be strength to go, hey, I got AIDS. Because of the stigma around AIDS in the United States. But just for health in general, to want to know, you do have to have strength to go say, man, I'm going to go to the doctor and find out if I do have cancer so I can make sure I get on it early. Now, that is strength. That part would be strength to be able to face whatever the results are of these tapes. That is strength. So it's a little bit of both.
Yeah, of both. So it kind of reminds me like knowledge is power in a way.
Exactly.
Okay. Trevor, do you want to chime in on that a bit?
Yeah. I think there is need for us to redefine the conversation around health and men, because again, men see themselves as gatekeepers and not direct beneficiaries. And I think for me, that's a challenge, because First of all, when I look at our parliament, our decision-making spaces, you'll see that our parliament has only 34% of the seats occupied by women and the rest are men. But the conversations around health for men are very, very, very minimal. And yet these are the discussions they're always having. So men like to see a lot of self-reliance. I can rely on myself. And maybe if I'm having a flu or a fever, I'll just jog and then it will clear, or I will, just so they think they can overcome sickness with strength, physical strength. And I think that's where the challenge is, especially now where they're having a lot of energy for the young men. So we need to bring back the thinking that it is more masculine actually to know your health status and know where you're standing in terms of health than the neglectful nature of, I do not want to know that I have HIV, and yet you really feel you've been in risky behavior, you've been doing all the things that could precipitate an environment for infection. So us redefining that it is more masculine for you to seek health services and seek health care rather than waiting for things to get bad where you can no longer use your physical energy to control and now you really need the doctors.
Yeah, it's more masculine to seek health, and there's wisdom in that as well. So it all connects. So let me ask, we've been talking about the issues. So what creative ways can we use to redefine this, to encourage more men, to talk about their health, to go see a doctor? What can we do creatively, or just from your own experience, what have you done that you see is working, or even in your community to address that? Norm, let's start with you.
I think things like this, conversations. I was on a call with about 20 men, earlier this week. I think conversations, about health, men talking to men about it. And I think those are the kind of things you do. I think you guys do a lot of creative things where you tie testing to a great event. So people come and they see others being tested. So I think those kind of creative things. But I think the most powerful one is when you get a group of men together, sitting in a room, and they get to talk about it. So I think that is probably the most powerful way to change the environment.
Yeah, thank you so much. Because this reminds me about the whole concept of brother to brother when you talk about getting men
Exactly.
in a room to talk about it
Getting
from
men
one brother to
and
another. Yeah,
man to man conversations.
great. Trevor, from your experience.
Yes, so for me, I believe what would work well right now, like the conversation we are having right now, for me is very important, the intergenerational conversations, because I see that young men really follow and are influenced by the older generations. You can see it in politics, you can see in sports, you can see by the preachers and the men of God. And so if we hear the older generation telling us how they are responsive and responsible towards health, the challenge is the ones that we have sometimes make it look like health is not really something we should take on. And so because we have not yet walked that journey, then we'll think, okay, no, it's not that important. So that is something that I would prescribe, intergenerational conversations. But then secondly, a lot of men claim to be at work in their workplaces. Women are working as well, but men claim to have that a lot, and that is why they are not going for services. And so I would recommend having workplace service outreaches. I've seen it happening where as someone comes with a booth, maybe near an open place where people are working, maybe garages, bars, and people get tested because now there is no excuse because the services have been brought closer to you. Yes, but then men also love sports a lot. And so I would think that events that gather men so much, in Uganda, it's football. Soccer is really loved so much. So you just ensure that whenever the such gatherings are happening, men are accessing the services. We've also seen what is working out is whenever we are having sports shows, and this is for something we are trying in AHF Uganda, sports shows where they're talking about sports bulleting, things that have been happening. We've penetrated such spaces because we know that men are tuned in a lot. And so we use such opportunities to send the messages. And it's working. It's really working. And they're assessing, especially the STI services, they are coming.
So that means bringing the services closer to the people, right? Closer to men where you can find them.
Yeah, I was going to say this is something we did a few years ago. A friend of mine, we were instrumental in taking like sodas, there's
Mm-hmm.
sugary drinks out of school, put in more water and juices.
Mm-hmm.
And during that time, a good friend of mine was a diabetes specialist. He was the guy that people went to before they had limbs cut off. And we were trying to figure out, just for the same reason, because how men are, how do we get more men to get checkups and do what they do? We went to barbershops. In the United States, barbershops is a place where our parents always dropped us. We always went to get our hair cut
Mm-hmm.
once every 2 weeks. That's where all the black men are and all the kids are. So we started going to barbershops. So what we did, we had a bunch of nurses come to barbershops, and
Mm-hmm.
we would be in, say, in Los Angeles, we would be in 40 barbershops. And we would have
Mm-hmm.
nurses come into all those barbershops and test guys for hypertension and diabetes and whatever. It was very successful. We tested probably 20 or 30,000 men like that. But invariably, in every situation, we found guys that were ready to have strokes, blood pressure,
Mm-hmm.
170 over something. We took guys straight
Wow.
to the emergency room, and we found guys that had never had physicals before. So again, what you say, you got to take the services to where they are. If you go to the soccer game and you had 30 nurses sitting out there, no, you getting tested now. That kind of peer pressure would make them do it. The barbers loved it. The television station in the United States loved it. And what I did in all the cities, I brought former basketball players to come and just hang out with the guys and talk to the guys. And all the
Mm-hmm.
guys got tested. So bring the services to the people is like a great way to do it. Like you said, the soccer matches. For us, it was the barbershop. We went to the barbershop where guys go. And we tested, like I said, with 20,000 guys.
Wow.
Mm.
Nice.
But you've also raised something that it's really wonderful hearing you and Trevor share your experience and how we can turn this around. But there's something you've raised that I think is also important, especially in today's age of influencers. If you said you had to go with a couple of basketball players like yourself,
Oh, I had
who
them
are
come. Yeah.
actually known, so it talks also about the power of influential voices, to be able to inspire other men.
Yeah.
I got tested. Come do this too. Or, I'm going to the doctors. You need to do this. I think we need to encourage more influential men like yourselves to speak up on the issue of men's health. I think that's very important. If we can get more people talking about it, more celebrities, more leaders, whether it's religious, political, or social leaders in our communities, our community leaders who are men. We need to hear more voices encourage this, because I think that, again, going back to what Trevor said, the younger men look at the older men and they follow in their steps. So I think that's also something we need to
Yeah.
think about as we creatively try to get more men to seek health care very quickly. All right. So now I just want us to look a bit about from life experiences. Norman, knowing everything that you know and your journey, even in this space, what's one health lesson that you think that you wish every man your age knew? And this is an opportunity for you to bring that to the fore.
I talk to guys all the time. Like I had a friend that played college football. He weighed about 260 pounds on about a 5'10" body. And his doctor told him at his last visit, he said, let me tell you what your stroke going to look like. You don't have a stroke. Your right side is going to be paralyzed. He said, you're a strong guy. So you're not going to die, but you're going to be in a wheelchair. And my friend got pissed off, but he realized it shocked him into losing weight, exercising. I put him on flaxseed. He just called me 2 days ago. Cholesterol levels down, getting off the medication. So if I have to say something to my contemporaries, it's like, listen, we're in the fourth quarter. We have to
Mm,
start taking care of ourselves, and I don't believe in like, I'm gonna go on a diet. No, you change your lifestyle. You change how you eat, you change what you eat, and you have to exercise. So I just encourage when I do talk to my friends, it's like, look, guys, we're in the last quarter. We need to really make life. It's not about one thing. It's a whole lifestyle. It's exercise. It's watching what you eat. It's taking your vitamins. It's doing and trying getting rid of stress. So it's a whole lifestyle change. So when I speak to them and I tell them one thing, it's like lifestyle change. We got to do many things. It's not just one thing. We have to do many things to turn this corner.
So before I come to Trevor, you made reference when you say we're in the last quarter. So for the purpose of listeners who may not be from the United States, I want to believe that's a football reference. So maybe you should break
That
it. When you say we're in the last
it,
quarter, what does that
it can be
mean?
it can be like football, basketball. I think in soccer you play uh
Yeah,
three sectors, right? So they can say their
two. In
last third.
soccer,
We
it's
say their
two,
last
and then
quarter. So
mhm.
basketball, we play 4 quarters. So we're like 3 quarters and over. You're in the final quarter of your life, And I'm not going to tell you
Okay.
my age right now, but but I know
But
Trevor's
I
already look.
think we
Look,
know.
I will tell you. Listen, I'm not ashamed of that. My birthday is next month, and I'm turning 70 years old,
Wow.
and
Oh, sorry.
that's why
Can
I
you
told
say
Trevor
that
I'm older
again?
than his dad.
Oh, you said you're
I'm turning 70
61.
years old.
By 10
Oh,
years.
No, I'm
70.
69. I'm
Oh, you're
69. I'm getting ready to turn.
69. Wow, you're almost
I'm
70.
turning
Okay,
70
that's
on my
good.
birthday.
I'm honored.
And listen, listen, and lead by example. You get out. That's why I try to push the call to 9 o'clock because I work out in the morning. You guys make me do it at 8. It's like I had to get my workout in. That's my lifestyle. I wake up, I get my workout in. If I go out drinking one night, you can believe the next day I'm drinking all water. I'm doing all those things that I know kind of work. And, that's what I encourage guys to do. We have these conversations because a lot of my friends are former athletes. We're all the same age group. And they're working, we're doing things. But it's like, hey, we got to take care of ourselves. And all of us study and read, and everybody brings something different to the table all the time. And I'll share a lot of those things after we get into more and more conversations, but it just makes a lot of sense. When it makes sense, it's like, okay, let me try it. If it's not nothing crazy or it's not nothing invasive, and as long as it's natural, if it's an exercise, it's this. The older you get, it's core strength. You got to keep your
Mm,
core strong. You got to keep your flexibility. You have to do this. So there are a lot of different elements that come into men's health, and those are the conversations we have to have with these young guys and even our contemporaries, not just the young guys, but and then again, I think that's the wisdom. When you've been around this many years, you learn things. You learn things from everybody. You
mm,
have to be open to learn. I'm sure Trevor's going to teach me a lot of stuff when I come down from the symposium. And I'm
Mhm.
open to it. I'm
mm.
not going to discount it. Wisdom comes from many different places, and you have to be open to that.
Before I come to Trevor, I do appreciate you sharing, and even from a personal place, when you talk about the fact that you try to do your workout every morning before you begin your day, because sometimes people say, "Oh, but I'm so busy. I have to get to work. I can't do this at this time." Or, so it's good to hear that. It's good to hear that it has to be more of a lifestyle. You have to make the
It's a
decision
lifestyle.
you want to be here for your family. You want to be here for your loved ones, right? You
Yes.
want to have as much strength as you can, even if you're in the last quarter. You still want to have a little strength to be able to do
Yeah,
the
and I
fun
tell I
things
tell
that
my
you
wife,
love.
I tell my wife, you can never be too busy to take care of yourself. You
Never be
never
too
can be too
busy to
busy, and
take
that
care of
and
yourself.
never can be. And then, that's part of my financial conversation too. You never be too busy to go look at your own financial stuff. Don't have people doing everything for you. You have to do things for yourself just to understand it. Even if you delegate it, you want to understand it before you delegate it. So
Yeah, never be too busy to take care of yourself. I think that's a good. It seems like something you
no.
can put on a t-shirt.
Yeah, yeah, true.
So here comes the
Mhm.
business. Let me go register that trademark before you start making it. Then I can make some money off all your t-shirts. Let me go.
Oh.
I'm going right now this morning. Never too busy. Take care of yourself. So if I see that shirt, you guys gonna owe me a royalty.
Mm,
So funny.
we are.
Yeah. Trevor, what if you could talk, so you're here with Norman and we're having this conversation about mental health. So my question to you is going to be twofold. Or number one is if you could talk to other young men from one brother to another about living healthier, longer lives, what would you say to them? Um, and I would say particularly for younger men like you. What would you say to them about living healthier, living longer? And then the second part of the question is, if you could tell Norman from his generation, what do you want to see more of from them for young men that you think would be very beneficial as we continue on the journey towards getting more men to be comfortable about their health, talking about it, and seeking help in time?
Thank you. And again, I am honored to be a part of this discussion. There's been a lot of learning, a lot of beautiful exchange. I'm loving the conversation. Yes. So, I'm going to add voice because there's a lot of wisdom that has been passed down by Norman. And, for me to just emphasize that when I look at young men are living like there is no tomorrow. Okay. They doing all the risky behavior. They're engaging in all sorts of acts, not thinking about the future and what is this alcohol going to do to me in the next 15 years. What is this kind of eating going to do to me? So there is not that vision. We're not living with vision, especially when it is in regards to health. So my advice to young people, first of all, would be, let us live like we let us live for longevity. Let me say, let us take care of our bodies, because our bodies is all we have until we leave this world. So crushing it before you reach your 50s or your 40s is not going to do you any good, and it's not going to guarantee your sustenance on this earth. And then for young men living with HIV, again, it's an issue because even after they have tested and they know, they are not adhering to their treatment. And so you will find we have almost more age-related deaths among men than the women. So it's a challenge because their relationship with the treatment is poorer. And so my advice to young men still would be, you're not weaker because you have HIV. You are not any less worthy because you have HIV. So we should ensure that we build that right self-esteem, so that we can be able to live, because again, we are all we have. Other people are just seasons. Maybe you're afraid of a particular group of people. Maybe you have a spouse or partner that rejects you because you're positive, but with time, you're actually going to meet people who are loving, more concerning, and give you the right attention. So we should live knowing that we are all we have, and taking care of ourselves is a very big plus. In regards to Norman, there's quite a lot, but let me see where to start.
Watch it now. Watch what you say now. Watch what you say now.
For Norman, because we've not been here before, myself and young men like me, would like to hear more of what you did when you were younger. Because what we see now is Norman at 70. But when I went to Google, I saw very youthful pictures of you, and that's the image I had in mind before I came to this conversation. So I want to know, I'm very interested in, what are the choices you made at 27, 28, 29, 30? Of course, across relationship-wise, health-wise. So I'd like to hear those stories because they help us form the right choices. Right now, we are struggling a lot with, oh my God, I am new here and I do not know how to navigate this thing. But if we hear more stories from Norman, what has kept you consistent with your health, exercises and all that? Because sometimes someone tries for 2 weeks and they're dropping out. 2 weeks, 3 weeks, and they cannot maintain a routine in the gym.
Yeah.
So
that's true.
What has kept you going? What has inspired your consistency? What choices did you make as a young man so that we can feel like that is going to inspire us make the right choices as we grow? But otherwise, this has been a great discussion. Thank you.
Yeah, and that's why I say conversations like this are the best learning ground, the best place to have these exchanges. And in the conversation, like I was telling the ladies that were around the conversation, sometimes men need to be in a room with just men to talk about these things, because because we talk to them a little different when it's just us versus when there are other women around the room. Because we can be a little harder, we can be a little coarse, we can say it the way we want to say it, and without anybody else in the room. So I think, again, conversation like this are wonderful, and I'm looking forward to Trevor. And when I do come to Uganda,
Yeah.
it'll be great to sit in a room with about 10 or 15 of them to
Yeah.
just have a conversation,
Absolutely.
talk about my experience in the United States. And
So Trevor also asked you what you did when you were younger, that you could some tips that has kept you
but that's
consistent.
the conversation when it's men to men.
Oh, okay, okay, my bad.
Listen. Part what he did say is very true. I am this person because of all those experiences. Why I was
Mm,
different, I don't know. There's a certain kind of
mm,
discipline I had to have to play professional basketball, and part of that discipline, you
mm,
can have too many bad physical habits because we always say there
yeah.
are pros, and then there are pros. There are
Mm,
some guys that just happen to be a pro, and then there are pros who are your better pros. I would say I
mm-hmm,
was in the other group. So I had a different kind of discipline. Because of my experience coming from a broken home, I always wanted a family. I always wanted kids. I always wanted a family. So I always wanted those things. Uh, Tons of mistakes along the way. Probably going to make tons more before I leave this earth. So, my favorite saying in basketball, and we can say it in life too, if you show me a man that's never made a mistake playing basketball, I'll show you a man that's never played basketball. If you show me a man and say he's never made a mistake in his life, that's somebody that died when they were a baby before they got here. So we all make mistakes. It's how you respond to those mistakes and how you grow from the wisdom that you learn. But we'll have those conversations in a brother to brother conversation
Yeah.
where
I
I can get
agree.
in
I
them and they
agree.
can get
I
into
think
me. So
something would. Yes, this is something that's coming out of this, and it's that we need more conversations with just men, intergenerational dialogue and
totally.
conversations with men. And I'm really happy because that's something that is happening. We're also seeing even like men's clinic, men's. We're having clinics for men so that they feel comfortable to go in, and be able to open up about their health. So I'm looking forward to this
Yeah.
conversation happening, and I'm looking forward to many more happening, not just, and I hope that as
Yeah.
people listen in, that's something that they take away, that some man who is listening to this can say to himself, how can I gather a group of men together for us to talk about our health? How can I engage the community so that, we encourage more men to seek health on time, to go get tested, to check their blood pressure, or to even just have the conversation, and how do we dismantle those norms, those harmful norms that keep men away from seeking care. So please let me know when that conversation happens. I'd like to report on it on the podcast so that at least we can do some sharing, some best practices sharing. But it's been really lovely. And just going back to what Trevor talked about, the stigma, even with HIV, I do feel also that even as we have these conversations with men, that's something that needs to be talked about. It's
Yeah.
also empowering healthcare providers to be sensitive, even when they engage men, to not be judgmental, or even if someone comes with whether it's an STI or comes to seek HIV testing and they're positive, it's about how we treat them, the empathy, the compassion that comes
Yeah.
with care, and just being able to make them comfortable enough to want to come back or to want to open up. So it will take all levels of the society, from individual to family to institutions and the community at large. But I'm very hopeful, especially with the work that you and Trevor, Norman and Trevor, you do. I do believe that more men will get to benefit from this. All right. Before we wrap up, I'd like us to just lighten things up a bit. And we're going to do a quick fire round. So this is if you could only pick one. If you could only pick one. No overthinking. Don't overthink it. The first answer that comes to your head or pops up for you, please. So just think of this as a health checkup, but in a fun way. So I'm going to start with Trevor, and then I'll go to Norman. You won't answer the same question, so don't worry about it. We have a level playing
Okay.
field. You're not going to answer the same question. So, but I'll start with you, and just really quickly, don't overthink. Are you ready?
Okay, I'm ready. Let's go.
I'm excited about this
Let's go.
question.
Let's go.
Okay, Trevor, if you could only pick one, never skip sleep or never skip workouts.
Never skip sleep.
Okay. Norman, eat your favorite meal forever or try new foods every day?
Oh, eat my favorite food forever.
Okay. Trevor, a lifetime of checkups on time or never needing medicine?
A lifetime of checkups.
Okay. Norman, a strong body or a sharp mind?
Sharp mind.
Okay. Trevor,
Does that mean I
live
have a
to a...
strong body?
That's worse. That's worse.
No, you have to pick only one.
That's worse.
The strong
Don't you choose
body.
both? Don't you choose both?
No, you can't choose both for this one. Okay, Trevor, live to 100 or stay 27 forever?
Live to 100.
Norman, walk stress-free or travel whenever you want?
Stress free. Stress free.
Okay. Trevor, pick one, team sports or solo fitness?
I would go with gym sports. I've messed up in solo fitness.
Okay, Norman, give advice to your younger self or get advice from your future self?
Give advice to my younger self.
Okay. Trevor, cook your own meal or order takeout?
Can we freeze?
Cook, man. Cook.
Okay. And the last question to Norman. If you could only pick one, health without wealth or wealth without health?
Health without wealth.
All right. It's been such a pleasure having the both of you on this conversation. I've had so much fun. And then just also talking about real things and hoping that a lot of our listeners walk away from this with a change in mindset and to collectively not just only talk about men's health, but also ensure that even as we discuss in policy spaces, community spaces, even in healthcare settings, we should remember to talk about men's health as much as we also talk about women's health or health in general. And so that's something that I'm deeply appreciative of the both of you for coming on this podcast. Thank you so much for joining. And do you have any final words? Just as I wrap.
Only to say that I'm waiting for Norman in Uganda.
So, Norman, you have an invite
I've
from
been there.
Trevor.
I'm going to come back. Believe it or not, there's a large population of Ugandans in my hometown where I'm from, Macon, Georgia. And that was when I
Nice.
went down with a group of Black mayors there. So we spent about 8 days there. It was fun. I had a good time in Uganda.
Nice.
Great.
So
All right.
I'm looking forward to getting back. I will be back down for sure. And for sure, I'll look you up, Trevor.
Yeah, true. Looking forward.
Awesome. Sounds good.
Yeah.
Great. So today's conversation reminds us that men's health is about more than avoiding illness. It's about choosing to live healthier, longer, and stronger lives. Whether it's opening up about tough topics, making time for regular checkups, or sharing lessons from one brother to another, men have the power to change the story of their health. The real question is, will we keep waiting until it is too late? Or will we start embracing health as part of what it means to be strong and to be wise? Until we come your way again, it's Kemi Badamasi. Thank you. Bye-bye. Thanks for being part of the global public health revolution. We hope today's conversation left you inspired, challenged, and ready to shake things up. If you loved this episode, don't keep it to yourself. Subscribe, leave us a review, and share it with your network. Let's keep the momentum going.